trials that were not randomized in case series studies to pool the data together, but did include one major randomized control trial in the journal Neurology in 2020 with over 1,000 subjects, which they followed over a year. So they treated over 1,000 patients with BPPV successfully across 8 hospitals, and basically half of the people received the supplementation of vitamin D and along with calcium, and then the other group did not receive anything. And then the researchers followed up with them a year later. So this study showed a significant difference in the group that was treated with the vitamin D and the calcium. Now, these findings have been supported by several review studies which looked at the risk factors of recurring BPPV. And so the most was this systematic review and meta-analysis from 2021 published in the journal Neurology, which analyzed over 3,000 patients with both prospective and retrospective studies. And what they found was that vitamin D deficiency was a significant risk factor for recurring BPPV. Osteoporosis was also one of those risk factors, which fits the overall bone health theme of positional vertigo coming back. What makes this meta-analysis strong is the use of the prospective studies, which are considered stronger studies compared to the retrospective studies. This is because in prospective studies, the researchers establish their study first and follow a group of people over time instead of looking backwards at the records, which is done in retrospective studies. There were several other reviews published in peer-reviewed journals that support both the vitamin D deficiency and bone density being risk factors for BPPV coming back. These include a clinical review in 2021 published in the Journal of Clinical Medicine, and most recently, a 20-year retrospective study of 1,400 people published in 2023 by Cassini and Gufani. However, a similar study published in 2020 in Ear, Nose, and Throat Journal did not support the connection with vitamin D. However, this 2020 study did support the risk factors of osteoporosis and osteopenia, which fits into the bone health pattern. Now, what made this study strong is that it was a systematic review and a meta-analysis, but only included retrospective studies, and no prospective studies showed the opposite to be true.